Hi, and welcome to Healthy Living. I am here today with Kelly Presnell, Director of Public Relations and Marketing here at Hilton Head Hospital. And as always, you have a wonderful show lined up for us today. We're going to be talking about infectious disease, and I'm really excited about this because I know you're thrilled to have the doc on staff here.
Right. We have recently added 2 physicians who specialize in infectious disease, which is a subspecialty of internal medicine, and it's just important to have that continuum of care within the hospital to help patients get out of the hospital sooner, quicker, faster, and to have that specialized knowledge with somebody with this particular area of expertise.
Great quality,
right.
Great inpatient quality care.
For our hospital, right. So, and it's all based on community need. You know, that's when we bring physicians onto the medical staff is based on community need. And having this specialty, infectious disease, touches every aspect of care within the hospital, whether it's just pneumonia, heart disease, diabetes. They focus on all areas, which is great for the rest of the medical staff that's here to have them as a resource.
So, on Healthy Living today, we're going to be talking to Dr. Ludwig Lettau about the infectious diseases. Stay with us. We'll be right back here on Healthy Living.
We went to the emergency room, and thank heavens we did.
They discovered that I had 2 totally blocked arteries, and I ended up having double bypass open heart surgery. Well, I stayed in the hospital for just a few nights.
To the staff at Hilton Head Hospital, I would express the deepest gratitude that I possess. They literally, quite literally, saved my wife's life.
We are here today on Healthy Living with Dr. Ludwig Lettau. I love your name. It's beautiful. Thank you so much for joining us. We've been chatting a bit before we actually started the taping, and you have quite an interesting and diverse background. I'd like to talk about that. First of all, as a doctor of infectious disease, I'd like to know a little bit about what that actually means.
Well, a doctor infectious disease specialist is someone who's trained in internal medicine, but then went out beyond that for another 2 years of specialty training devoted to basically the diagnosis and treatment of infectious diseases. And that sort of summarizes what we do.
In a nutshell. Well, we were talking again before that with some of the mainstream media, some of the movies out there, some of the books, there's a lot of mystique, if you will, about some of the infectious diseases out there. And I think one of the reasons that it's great to actually talk to you is that you can demystify some of the things and chat a little bit, if you will, about how we are actually referred to you. How would we come to you?
Well, let me say that infectious diseases are so common that the vast majority of infections that people get are either maybe relatively minor and go away on themselves, or their primary care doctor can take care of them. We tend to see, or most appropriately see, the more complicated infections that are patients that have fevers that don't respond to antibiotics, and the question is this, what is this infection? What part of the body is it? How do we? So we tend to see more problematic type infections, and in general, most of our outpatients are referred by other doctors.
When I think of infectious diseases, or I guess when I think of the disease process, and help clarify this for me, I think of diseases of function, okay, like heart disease, diabetes, things like that, and then diseases of infection or of microbes, if you will. Is that kind of what divides everything up? bacteria, viruses?
Well,
is that what we're talking about?
Yeah, a lot of doctors just deal with one organ system, whether that's heart or liver or kidneys, but infections can involve any part of your body, from the skin to the brain to the blood, and so we deal more with infection as a problem rather than a certain part of the body.
Is infection a broad spectrum term that means what? We talk all the time, that looks a little infected, that's a little infected. Yeah. What does that really mean?
Well, it's, infection basically means that you've been contacted or invaded or affected by a microorganism, whether it's could be a virus, bacteria, a parasite, a fungus, a TB-like germ. There's a whole variety of. Some are easy to diagnose and treat, others much more difficult. The problem sometimes comes up where patients have a fever, or they have an elevated white count, or they have an area of inflammation on their body or a swollen joint, and it doesn't respond to antibiotics, and sometimes it's not an infection. I think that's another one of the roles that we play is how to determine something is not an infection, or to withhold the antibiotics, or to steer someone in the right direction.
Do you do that typically through elimination? When I was reading a little bit about what doctors of infectious diseases do, it said that you're very much a mystery solver. That's part of what you do.
Well, that's
CSI.
That's part of the appeal to me of infectious diseases. That is somewhat as an element of a detective story to it. What is this infection? Where did the patient get it? How was it transmitted? That sort of thing. And then the other part of it that appeals to me is that you can usually treat it and get rid of it. And,
so it's a happy
ending to it.
Exactly.
Whereas other doctors, oftentimes with kidney disease or heart disease, they can control the symptoms and get the patient better, but they aren't able to actually cure the patient. So.
Doctor, when you've talked a couple of times now about fever as being something that would be a specific reason someone would come to you. I told you I have 6 grandchildren, and we are continuously dealing with fevers or rashes or things like that. At what point during the different age groups do you seek someone of your specialty? And I know that the hospital is so excited to have you and feel very fortunate that you are on staff here.
Fevers can have tremendous variation and significance. For example, children often have a high fever, 103,
right,
and without really much, in the way of a serious infection. It's just a virus can cause a high fever like that, and give the child the Motrin or something like that, and the fever goes away and they look fine again. So children are different from that standpoint.
They're different animals.
They're different animals, and whereas in adults, high fever, 103, 104, usually means some type of significant infection. Although, actually, it's also true some of the highest fevers that you get are actually from heat stroke and drug reactions that are actually not infections. So fever alone, again, is not not the equivalent of an infection.
Okay.
There are certainly cases that, and sometimes patients are getting this antibiotic and they keep getting fever and no one can figure it out. And it's actually the antibiotic that, the drug that's causing the fever, and you stop the antibiotic and within a day or two it's all gone.
So, it's complicated.
Yeah, well that's kind of one of the things that we deal with.
Yeah.
We help sort out what
why
the
isn't
problem
this
is.
working? Yeah,
why
is
this
it
working?
right?
Is the medication causing the problem, or do we need to switch to some other? And that's another difficulty or another reality, is that oftentimes you have like a pneumonia or something, but you really don't know what the germ is.
Okay.
It's actually true that 80 to 90% of pneumonias get treated without knowing the specific bacteria. We sort of know, and and we can make a good estimate of what type of antibiotics
will
help.
work.
But as far as knowing the exact germ, I mean, we don't. Usually don't. But either patients get better on their own, or the antibiotics work.
And please bear with me as far as, and I think many of us have the same opinion of not really understanding a lot about, what a virus really does, what a bacteria really does, how is that different than a fungus? Why do we have to worry? Is our body built to fight these things off? And is it because there's a vulnerability that we get sick with this disease? I know you've traveled extensively, and we were going to talk a little bit about your background. What did you see in different countries that you visited? You did mission work.
Yeah.
I just give you like 16 questions rolled into one. Yeah.
I tend to focus on the last question.
There you go.
What did I see in those countries?
Yeah.
That
might be different than what you would see from an infectious point of view than here in the States.
Actually, when I was a mission doctor in Malawi, this was back in the late 70s, we saw a lot of leprosy there. And it's very interesting. There's a lot of misconceptions about leprosy. It's actually one of the least contagious of all diseases. So, I would, see these patients. I wouldn't get on a gown or glove or really anything because it wasn't necessary. But leprosy is very interesting. It's interesting. It's actually there were experiments in leprosy in this country, and not experiments, but animal studies. And the animals that they looked at were armadillos, and armadillos is one of the few animals that are susceptible to leprosy.
To leprosy?
And some of these escaped, and there's now leprosy in the armadillo population in the southern U.S.
Is there really?
Yeah.
It's so. And now, would that be transferable to humans? Good question.
It can be. It generally requires someone to cut up a carcass or eat an armadillo. And there's actually been cases like that have occurred.
Are we vaccinated for leprosy?
No, we don't need to be.
Okay.
It's like I said, there's very little of it in this country, and it's not like easily, even from armadillos, it's not easy.
Right, even from the darn armadillo. Yeah, exactly.
You toss it in the bushes, you don't have to worry about it.
We're going to take a quick break. We're going to come back. We're going to talk more about infectious diseases, and I have a feeling this might be something that we need to do 2 or 3 shows on, because we've got a lot of questions for you. Stay with us. We'll be right back.
We were outside after dinner. Mary Grace was riding her bike and heard a scream that no mother wants to hear. We took her immediately to Coastal Carolina. We could not believe it was a broken jaw. They are gifted to do what they do, and they are there for the community. And as a member of the community, I will be forever grateful.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
We went to the emergency room, and thank heavens we did.
They discovered that I had 2 totally blocked arteries, and I ended up having double bypass open heart surgery. Well, I stayed in the hospital for just a few nights.
To the staff at Hilton Head Hospital, I would express the deepest gratitude that I possess. They literally, quite literally, saved my wife's life.
We are back here on Healthy Living. Again, we're here with Dr. Ludwig Lettau. I love your name, and I'm getting it now. I really am. We're talking about infectious diseases. In the first segment, we talked a little bit about infectious disease basics, if you will, and then we sort of went all around and talking about. I know you've done some mission trips, but let's begin with a bit of your background, since we tantalized everyone with our discussion.
Well, I went through my 4 years of college,
Right.
then 4 years of medical school in Wisconsin, and then I had a year of internship. Then I did some tropical medicine training in London in the tropical medical school, and then I'm a little unusual. I've done some of these extra things. Most doctors go through college and residency training and then specialty training and go into practice, but I've had a lot of other experiences. I've done public health school for a year. I was an epidemiologist for the CDC in Atlanta for
But that would
2
seem
years.
to give you a lot of breadth and depth as far as knowledge-based experience, looking for the
I think
unexpected.
So. I think so. I have a lot of interest in public health, and I'm one that is more likely to, where did this infection come from? This salmonella. We need to report that to the health department. And
When you
try
hear,
to,
go ahead.
Try to help the health department out by, reporting diseases appropriately and problems that come up that may be more of a community-wide problem.
Based on your experience, are we good consumers? Are we good at we've done hand washing shows here. Are we good at protecting ourselves? Because what made me, after you said that, it's the cantaloupe that has the, what is Listeria now?
Listeria.
Yeah.
Well, I think most people with common sense and good hygiene, reasonable hygiene practices, should be fine. I mean, it's always like we sometimes tell travelers to foreign countries, you can do everything right and still get sick, and everything
True.
wrong and not get sick. Sometimes
That's true.
It's just kind of the luck or bad luck and of happening to eat some fruit that's normally
Tainted or
contaminated.
And the other thing is, Kelly, you've got a 2.5-year-old. We got 2.5-year-olds. I've got grandchildren. Do we build up immunities to certain things, and then when like my grandkids are exposed to totally different things than I was or than my children were, that would make us a little bit more susceptible? Are we more susceptible to things as we get older when it comes to bacteria, viruses?
Well, I think I wouldn't say as you get older you're not really more susceptible unless you start getting some other diseases that compromise your immune system. I mean, it's true that aging, when I say aging, I mean 60, 70, 80, that by itself can weaken the immune system. Then you get a little more susceptibility or more serious consequences of influenza or certain types of pneumonia. But for the most part, healthy adults who are otherwise healthy are not particularly at risk. I mean, there's always germs and pathogens out there that can make anyone sick, but many of them are probably we get exposed to quite frequently and never turn a hair. I mean, to use the example of Listeria, which was recently in the cantaloupe contamination problem, Listeria is a bacteria that normally, it really only affects people with very weak immune systems or pregnancy. Another pregnancy is a vulnerability based on the immune system is weaker to prevent rejection of the baby in the womb. Pregnant patients and people with transplant or cancer patients can get big problems with Listeria, but most healthy adults generally would not. I mean, even
interesting.
Might make you a little sick, but not really of any consequence. You probably wouldn't even notice that you'd had it. So, So that's part of the interest of infectious disease is that...
when I think of also infectious disease, I think of HIV. I think of things that, again, have been in the media or that we've been exposed to. In the Southeast population, what are some of the things that are you seeing a lot of pneumonias? Obviously, it's flu season, so I'm sure that we're getting our flu shots already, probably.
Yeah. Well, influenza and HIV are really not unique to the South.
Okay, that's fair.
By any means. It's, in the Southeast, HIV is a big problem. It's becoming more of a problem in kind of rural
communities
communities, less educated, that don't seek care, or if they are able to get care, they don't have consistent care, or they don't take their medicines. That's kind of where that HIV is heading. We have Rocky Mountain spotted fever here. We have
Rocky Mountain spotted fever,
tick-related infections. The one thing we don't have in South Carolina that's always a source of confusion is Lyme disease.
Okay, I was just going to ask you about that.
Is
there such a thing?
Well, there's plenty of Lyme disease, but it's mostly sort of Virginia and northwards. And the source of confusion sometimes is actually a tick bite that can cause kind of a round rash that never goes on to anything else. But people look at it and say, well, that must be Lyme disease. But if you actually test them, they do blood tests, they don't have Lyme disease. It's another virus that hasn't quite been identified.
Cat scratch fever?
Cat scratch fever is...
I don't know. I was just,
It's another interesting infection. I mean, there's a lot
of fun stuff, isn't it? Yeah.
You come in contact with animals, and
I don't want to hear that. La 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 la.
Yeah, people. Oftentimes, those are farm animals or wild animals. I mean, there's a few things you can catch from your pets, but
I have a
the
question.
benefits of pets far outweigh.
Oh, I agree with that. I have a question for you.
Yeah.
Do many of us know how long it's been since we've had our last tetanus shot? And is that something to really consider? I was telling someone I was going to be interviewing you today, and they were like, have you had your tetanus shot in the past 10 years? I'm like, gee, I haven't even thought about it.
Well, tetanus is something, the bacteria is called Clostridium tetani, and it's actually in dirt and soil.
Okay.
It's
everywhere.
Kind of everywhere.
Okay.
Yeah. I mean, and tetanus, if you get, the sort of most tetanus-prone wound, if you step on a nail.
Right.
In a barnyard,
if I have a rusty nail.
Step on a rusty nail in a barnyard. I mean, that would inoculate this germ up into the wound, and there it would start growing and producing tetanus toxin, which then can cause tetanus, the clinical tetanus. Most of us have had enough shots over the years that it's not going to happen.
Okay.
In my 20 years in South Carolina, I've seen one case of tetanus, and there's an older woman. She must not have almost ever been vaccinated, but there's no question that's what she had. And she did all right. She was on the ventilator for a while. And
you love what you do, don't you?
Well, it's a huge variety of interesting, problems.
Phenomena.
And things change. I mean, one of the things that are changing the most is that we're now seeing all these drug-resistant germs that are becoming more difficult and more, not necessarily more pathogenic, but more harder to treat. And that's been kind of an evolving problem. Most people don't need to worry about that.
Right.
Coming into contact with, highly resistant bacteria. It's really more of a problem for patients in hospitals. What most people encounter probably nowadays is this MRSA.
Yes, the MRSA virus.
Yeah, well, it's a bacteria.
Okay.
MRSA is an acronym, stands for methicillin-resistant Staph aureus. It's basically a staph infection that is a little more resistant, but we still have plenty of antibodies to treat it with.
I'll tell you what, this has been fascinating. Like I said, you might have to come back because I think each thing that you talk about is really worthy of a discussion. We basically just sort of touched the tip of the iceberg for this. But we do appreciate you coming. We thank you all for joining us here on Healthy Living, and we will get you back. Thanks again. Bye-bye.